Okay, folks, welcome back. Now we are on Module E, Law and Ethics. Our objectives are to describe ethical conduct, describe a resident's rights in the nursing home, give examples of abuse, neglect, and misappropriation of property, explain the role of the healthcare personnel registry, and explain the role of the nurse aide in securing informed consent prior to providing care to the resident. Okay, so the term laws or rules made by the government to help protect the public. A person is liable. Liable means that they are responsible. If laws are not obeyed, this person could be fined or jailed. There's two types of laws. You have criminal law and you have civil law, and we'll talk about those a little bit. Most of the laws that we are thinking about, that we hear about, are criminal laws like murder and rape, things like that. Civil law is against property, typically like theft, things of that sort. Okay. So the word tort is a wrong committed against a person or property. It could be unintentional or intentional. The term malpractice, and we do hear a lot about that term, is giving care for which you are not allowed legally to do. So as a nurse, if I was, say, on an airplane and somebody was having a heart attack, it is well within my scope of practice to do CPR on that person. It's actually, you don't have to be a nurse to do CPR, but if for some reason somebody was choking, I could do the Heimlich maneuver on them. That's in my scope of practice. But I could not do an emergency tracheotomy. That is not in my scope of practice. And even if I successfully did that tracheotomy and opened up an airway and saved their life, I could still be sued for malpractice, even though the outcome was positive. Negligence or actions or failure to act or give proper care resulting in injury. Make sure that anytime somebody's talking to you about something being negligent or negligence, legally there has to be a resulting injury. Just because somebody did not give proper care does not mean that legally they could be charged with negligence. We do have to see some type of injury. The terms assault and battery a lot of times are used together as if one goes with the other, but they are actually two separate entities. Assault is the act of threatening to touch someone without proper consent or attempting to touch them without that proper consent. Battery is when that person is actually touched without consent. This could also be performing a procedure or task that the resident has refused. So in the example of Mr. Jones, it's time for his bath, we go in and say, Mr. Jones, I'm going to give you a shower. And Mr. Jones says, nope, I don't want a shower today. And you say, well, I'm going to give you a shower whether you like it or not. That's assault. Because we have threatened to do something, to touch him, handle him in some way, and he already told us he does not have our consent. Battery would be when we proceed then with the bath. And we give him a bath, and he's screaming the whole time, saying, no, 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 I don't want a bath. So what do? Do we let people just refuse their bath day after day? No, I'm not a good advocate for that because I'm going to be the first one who says to them, you don't smell very good, or this isn't very good for your skin, or, this isn't very healthy for that wound that you have. And so I'm going to talk them into it. If they don't want to shower, we should ask them why. Why don't you want to shower? It could be because it's too cold in the shower room. It could be they don't want people to see them naked. So why can't we work around that? We could do a bed bath and keep them covered the whole time. with multiple blankets if they're cold. If they don't want anybody to see them naked, we could, again, wash underneath the blanket or the sheet. Have them do as much for themselves as possible. We could have a family member come and help them instead of a staff member if that's something that would help them. But we can't just do things because it's what's best for them if they refused it. All right, consent is the right to decide what will be done to the body and who can touch the body. So there's multiple types of consent. You have written consent, verbal consent, and implied consent. Now, the nurse aide cannot gain written consent. The doctor can get written consent. The nurse can get written consent. The nurse aide cannot get written consent for anything. You can get verbal, and you can use implied consent. Verbal consent would be, hi, good morning, I'm going to be giving you a bath today, is that okay? And they say yes, that's verbal consent. Implied consent would be, you go in and you say, good morning, I'm here to take your blood pressure, and they don't respond verbally, but they do extend their arm out toward you. That would be implied consent. Also, if you are taking care of somebody who is unconscious, they cannot give you verbal consent, but they do not give you any type of indication that they do not consent. That could also be termed under implied consent. The term invasion of privacy is the violation of the right to control personal information or the right to be left alone. We've already learned about HIPAA. HIPAA tells us the law's view on sharing personal information, but invasion of privacy goes a step forward, further with that, and also adds if somebody is in their room and we knock and they say, don't come in, then if we went in, or if we went in uninvited or didn't let them know we were coming, that would be invasion of privacy. Opening someone's mail without being asked or gaining consent for that would be invasion of privacy as well. Also, if we went into somebody's room and we were doing a procedure and we left the curtain open where other people could see what was going on, again, that would be invasion of privacy. So keep in mind, these aren't just ethical issues, there are also legal ones as well. Some more legal terms would be false imprisonment. This is unlawful restraining or restricting a person's movements. That can be done in a lot of different ways. If you have a person who is in the bed and they are bedbound and they cannot get up, if we take the sheet and we tuck it from top to bottom, where they can't roll over, they can't scratch their nose, whatever, that is false imprisonment. Putting somebody in a wheelchair and locking the wheels and knowing that they are unable to unlock the wheels when they want them unlocked is false imprisonment. Also, in all hospitals, all facilities that I'm aware of, having side rails up, even one, could be termed as false imprisonment. So there's a lot of different ways that someone could be falsely imprisoned. Defamation or false statements made to a third person that causes a person shame or ridicule or ruins a person's reputation. So if it's written, then it is specifically termed as libel. If it was verbal, then that is termed as slander. So we have this thing called social media now. We didn't have that back in my days when I was a teenager, or I probably would have gotten to a lot more trouble. If you wanted to say something bad about somebody, you could still say it. It was still slander. But unless you wrote it on a piece of paper, and that paper lasted forever, like social media posts do, it was still libel. But usually those pieces of paper disappeared. Your social media posts do not disappear. You can erase them. You can use a platform that only leaves it up for a certain amount of time, but it stays. The right person with the right knowledge could access any social media post you've ever created. So be very careful of what you post on social media, including pictures, comments, language that you use, because it is very common that employers now are going to look at social media to see, have you been naughty? Have you been bad? Have you been writing things or making comments or posting things that would not be considered professional for an employee working with their company? So it is legal for them to decline to hire you based on something that's on your social media. So keep that in mind. Some more legal terms would be diversion of drugs. Oh, let me back up a minute. Yep, I got everything. Never mind. Okay. Diversion of drugs is unauthorized taking or use of any drug, and fraud is an intentional deception or misrepresentation resulting in some unauthorized benefit. So diversion of drugs used to be, in the 80s and 90s, a really significant problem, especially amongst nurses. It was really easy to steal a patient's medicine and take it as a nurse. It is very difficult to do that now. They have come a long way in making sure that diversion of drugs is no longer as big an issue as it used to be. It's very difficult to get medication, access to your patient's medication, and even when you do, there is a really stringent system of how it is logged in and out, how unused doses are wasted and documented. And so if you're going into nursing, you will learn a lot about diversion of drugs as well. In someone's home, if you're an in-home nurse or an in-home nurse aide, it's very easy to divert drugs because there's just an pill bottle. And everybody knows that an elderly person is confused, and when they run out of medicine, it's not your fault. It's the caregiver. But it is illegal to take any medication that does not have your name on the prescription label. So keep that in mind. Fraud. This could again be a very wide variety of things that might happen. It could be that you're taking money from your patient somehow. You are writing a check out of their checkbook to cash, and you're cashing it. You could, if you're working for a home health agency, and this is something I don't agree with, is that in home health, a lot of nurse aides, one of their jobs is to do banking, to do grocery shopping, things like that for the resident. And that resident gives them a check, gives them, their debit card, their credit card, to do that shopping with. I do not think that's a good idea. We do have a lot of people that take advantage of that and that just are not very truthful when it comes to managing somebody else's finances. So that is considered to be fraud. Laws are very important. It informs people of what they can and cannot do. They are written to protect the public from harm. We could all think of a law that we don't particularly care for, but there are a lot of laws that keep us safe and keep our possessions safe as well. Are the laws perfect? No. Is the law perfect? Nope. But it tries. Let's just say that our country is set up to protect us in most ways. Okay. All right. So the nurse aide's role when it comes to legal things is, one, understand your range of function. Range of function, scope of practice, both of those are kind of interchangeable terms. When we talk about somebody's range of function, it's what they are legally allowed to do under their licensure, their certification, whatever educational background they have. For you, it's a certification as Nurse Aid 1s, and everything that you can do that's in your range of function, you're going to learn in class. There's going to be those skills that you're learning. Now, is everything that you will ever learn going to be covered in class? No. Okay, you're going to go to your facilities, you're going to go into specialties, and you're going to learn lots and lots and lots of new things. But the actual skills that you can do are covered in the class. If you go to a facility and they say, hey, we've got a program like More for 4 was one that I think Blue Ridge did for a while. They may still be doing that, where they check you off as competent on a select number of skills that sometimes can be taught, I think, in Nurse Aid 2. I think blood sugar is one of them. I don't remember what the other 3 are that they were doing. But it's only that extra competency is only good for the facility in which you are currently working and you've currently been checked off in. It does not carry over. So that, although while you are working in that facility, that could be part of your legal scope of practice, it is not. If you leave, it does not follow you. Keep your skills and knowledge current. Maintain your resident safety. Stay up to date on materials and supply use. Companies can provide very similar supplies, and sometimes this company's cheaper than the other company. The way that their supplies work or the quality of their supplies are not the same. And so you may be used to using a certain kind of product with your patient, maybe like something you're cleaning them with, or a lotion or something, a piece of equipment that's being purchased by your facility. Not every company's brand is the same. So you need to make sure that you understand the difference between what you have been using and what is being sent now or used now. Follow your facility's policies and procedures. Do no harm to residents or belongings. A rule that I've followed throughout my career is I'm really interested in seeing, especially like antique type things that people have in their homes and in their rooms, and I like old pictures and things like that. And your hands automatically want to go to it and touch it, pick it up, observe it. I have learned to put my hands in my pockets or put my hands behind my back to remind myself, only look, don't touch. Because that stuff, a lot of it's very irreplaceable. A lot of sentimental value, a lot of financial value to some of it. Report questionable practices and know your legal terms. Now, back to reporting questionable practices, you do not have to have proof that somebody is doing something incorrectly or wrong or treating someone in a manner they should not be. You don't have to have proof before you let somebody else know your suspicions of what you think is going on. If you think there's something going on, go ahead and report it, and then let your supervisor be the one responsible for then further investigating and getting more proof if there is really something going on. Okay, so you should have a handout that was posted with your PowerPoint here about vulnerable adults. Here on the screen, I see a lot of pictures of some vulnerable adults. I see a man there in the top middle that it looks like he's physically vulnerable. He's having some problems. Looks like maybe either getting up out of the floor, or maybe his knees buckled on him and he might be falling. To the upper left, I see a lady. She looks like she may not get up and move around very well. So again, she may be physically fragile. In the lower right especially, this kind of looks like maybe somebody that may have some confusion, possibly dementia. And so mentally, people can also be vulnerable. What makes adults vulnerable? A couple of things. One, age. A very old person, an elderly person, or very young also makes a person vulnerable. If they're dependent on another person for any type of care, that puts them in a more of a vulnerable state. Emotionally and mentally, if somebody cannot make their own decisions, it's hard for them to focus, that makes them more vulnerable. So also, not necessarily an elderly person, but it could be a younger person with a mental disability or a challenge of some sort, maybe a lower IQ. They're more dependent on other people for decision making and guidance. That would make them vulnerable as well. Okay, so people who are vulnerable adults are more prone to neglect, misappropriation of property, abuse, and exploitation. Neglect would be not providing services necessary for this person to lead a happy, healthy life. So if I was saying that somebody was going to be charged with neglect, they would also have to be some type of either a mental or a physical injury that has happened due to that neglect. Misappropriation of property. What you're seeing here on the screen in this picture, we're going to call this little lady Edna. It looks like there is a man demanding money from her. And she is dipping into her wallet and she is giving him money that I am going to say he is not supposed to have. So for whatever reason, he is taking money from her for his financial gain if it's misappropriation of property. Abuse would be some type of willful, physical, emotional, mental infliction of pain that results in injury. So that could be lots of different types of abuse. It could be physical abuse that would leave bruises, scars, lacerations, or cuts. It could be psychological or mental abuse. It could be that they're threatening them. If you don't give me that money, I'm going to make sure that you go straight to a nursing home. Okay, that's mental abuse. And then exploitation, using another person for your gain, either financially or otherwise, exploitation. So how do we prevent the mistreatment of those vulnerable adults? We take care of their personal property and we find ways to make sure that they they're not taken advantage of. Recognize signs and symptoms of neglect, misappropriation of funds, abuse, and exploitation. In your textbook, it does give you quite a few examples of that. If the nurse aide observes another healthcare provider abusing the resident, number one, stop the abuse. Okay, if it's a coworker and you work there, then it absolutely is your business. This is your resident. You're responsible for their care and well-being. And so go ahead and physically stop the abuse. And then immediately report that abuse to the nurse. If it's, if the situation is, heated, it's out of control, the coworker that is abusing the resident is maybe not willing to step away, put on that emergency call bell. Trust me, people will come running when they hear an emergency call bell. And some places have security, some people don't. But the situation can be taken care of, but you will need to get help to help you with that. And report any questionable practices. Again, you do not have to have concrete proof of something that's going on. You just have to have suspicion. Neglect examples would be such things as dehydration, malnutrition, untreated pressure ulcers, and poor personal hygiene, unsanitary, unclean conditions, such as being dirty, having to line feces or urine, inadequate clothing. Let's say that it's really cold outside, but yet they're only wearing a thin gown, and they're obviously very cold. And then the resident's report of neglect. We have to remember that anytime that a resident reports anything to us, any abuse, neglect, negligence, anything like that, that we do need to make sure and take it seriously, and we need to document. Okay, so now let's move on to misappropriation of property. Of course, some indicators, something you may see when there's been misappropriation of property is you may have the resident say, I can't find my antique picture frame. There's money missing from my checking account. Or I had some money in my wallet. I don't know what happened to it. I had 5 20s and now I only have 2. Something like that. Okay. So a lot of times you won't know there's been misappropriation of property unless a family member or the resident themselves kind of bring that up to you. Physical abuse. It could be a wide variety of things. We could see skin breakdown, lacerations, burns, bruises, places where ligatures or ropes have their skin's been tied down. Can be from a variety of things. When you suspect that someone is being physically abused, whether it is your resident, whether it's a friend, a family member, make sure when you're talking to them alone and independent of any person or persons that may be the people who are abusing them. So the family doesn't need to be present for this because it could be a family member. And co-workers as well should not be there when you are asking questions and talking to your resident about this. Now, not every time that it's true abuse is the resident going to say, yes, this person did hit me, they did burn me, they did treat me roughly when they were getting me up, and that's what happened. Sometimes they'll say, I fell down, I ran into the wall, I slammed the door on my hand, and sometimes it's true, and sometimes it's made up as a story to kind of hide the fact that somebody has done something negative to them. And a lot of times they feel like there's going to be some type of repercussions back to them. They're going to get in trouble. The person who abused them is going to come back and do more things if they report them. Make sure that you let them know that you can make sure that they are protected from that, and that you can support them through the decision to report it. Emotional or psychological abuse. This could be, again, a threat. If you don't do this or you tell about this, that something bad's going to happen to you. I did have an incident several years ago where a family member was in the hospital and they were pushing their call bell a lot because they were in a lot of pain. The nurse was not able to give the pain medicine every time it was asked for, and eventually the nurse came in and took the call bell out of their reach where they couldn't get to it. And that was definitely psychological abuse, because this person was in extreme pain all night long, was not able to get to a call bell, called out, nobody came. So needless to say, myself and another family member took it upon ourselves to file a formal complaint and report against that nurse. And I don't know what happened. I'm hoping that they were at least formally reprimanded for doing that. But they could have just said, well, I didn't know they didn't have their call bell or whatever. So just because somebody lodges a complaint does not mean that that person's automatically going to get in trouble for what's happened. But this could be a family member making these comments that could be termed as abusive. It could be a caregiver in a facility. It could be another resident. So keep that in mind. Also, this could, you could have family members or friends that are also going through emotional or psychological abuse. I had a family member that was being mentally and emotionally abused by her spouse for years. And I did not know the extent of what was going on. I did know that it was not a happy situation, and that I personally did not like the person very much. But I was not aware of the severity of the abuse that was going on. And I was very happy to find out that that person did leave the situation and is doing very well now. Exploitation. Again, this can be money. Doesn't have to be. It could be sexual exploitation. Do not rule out that just because somebody is elderly, that they could not be sexually exploited. You do have people out there that prey on elderly men and women in that way, family members and caregivers in facilities as well. A lot of times the exploitation is financial, though. It is, if you want me to keep taking care of you, you will give me your Social Security check. If you want to continue to live here, you're going to have to sign that Social Security check over to me, something like that. But it is illegal. You're not to do that. Even if you're a family member, you don't have the right to exploit your family member. So keep that in mind. Okay, so the Healthcare Personnel Registry. This is a complaint intake and healthcare personnel investigation section on the website where we get these PowerPoints, as well as where you can check someone's registry, CNA 1 registry standing, like that they are on the registry. There is also a portion called the Healthcare Personnel Registry that if you are an employer and you're hiring someone, you can look to see if they are listed as doing something illegal on the Healthcare Personnel Registry. Exploitation would be on here. Abuse would definitely be on here. Anything that we've talked about in this legal and ethics area that would happen in a facility by a caregiver and that's been proven would be they'd be put on this registry. And a lot of times when somebody's on this registry, it is to show future employers you do not hire this person. If they're on the Healthcare Personnel Registry, more than likely they will not be hired. And it's not legal to hire this person. So future employers do have to check that out to make sure that they are hiring someone that does have legal standing or certification to work in healthcare. Mistreatment of the vulnerable adult. Remember, abuse is a cause for immediate dismissal and posting on the Nurse Aid 1 registry or that Healthcare Personnel Registry if substantiated. Okay, meaning just because someone accuses you of abuse does not mean you will immediately be found guilty and be fired. There has to be some type of, has to be a witness. There's got to be some type of proof. There's got to be evidence. And I have watched these hidden camera videos of healthcare providers, and it is not just physically hitting or being rough with somebody. I have seen videos where they are talking to these residents very, very inappropriately. They're threatening them. That is as much abuse as hitting somebody and bruising their skin. There was an instance several years ago in clinical where 3 students were kind of palling around together in clinical, and they went into a room where there was 4 resident beds. Now, this facility no longer has these huge shared rooms, but at the time they did. But there was four resident beds in the room, and one of the residents was, well, let me back up. 3 of the residents weren't in there. They were out at activities or eating or whatever. But there was one resident in there, and there was a nurse aide in there with her. She was paralyzed on one side of her body, the resident was, and the CNA had her transferring her from her wheelchair to the toilet in this tiny, tiny, tiny bathroom in this room. And the nurse aide was having a really hard time getting the resident to pivot, to turn, and sit down onto the toilet because there just wasn't a lot of room in there, and of course this lady couldn't move one side of her body. So the students came in, and what they saw was the nurse aide verbally threatening the resident, telling her, you know, you have to move your leg. If you don't move your leg, I'm going to make you move that leg. You're going to get hurt. I'm going to hurt you if you don't turn around and sit down on this toilet. I, of course, wasn't there, so I'm not speaking as a witness. I'm speaking as for secondhand information. But eventually, they all 3 also saw the nurse aide hit the resident on her bare bottom. She smacked her several times, slapped her, and just kind of jerked her around and dropped her onto the toilet. There was no visible injuries to the resident, no bruising, nothing like that. The lady had what we call aphasia, which means she couldn't speak plain. She couldn't get out what she wanted to say very effectively, so she couldn't tell anybody what had happened to her. It was really just the witness of these 3 students that was able to report this incident of abuse, both verbal and physical abuse to this resident. So we'd never want something like that to happen while you guys are in clinical, but if it does, you never take it upon yourself to call out the staff member. You do want to stop the abuse if you can, but the reporting what's happening needs to go to your instructor. Then the instructor will take it to the proper person in the facility. So that's what you would do if you actually witnessed some type of abuse in clinical. If you're working there, intervene. You absolutely positively take it upon yourself to call them out and say, you ought not be doing that. And we're going to go to the supervisor and, you know, I'm going to report this. Not reporting abuse is aiding and abetting. So what that means is, legally, if you're a witness to this and you don't report it, you are as guilty as the person who is the abuser that actually did the deed. So, what if this is your best work friend ever and you're like, oh, she's just having a bad day, or, you know, she's having a tough time at home? It doesn't matter. If it's found out that you knew about it, you will also be fired. Okay? Because you are guilty. You're legally guilty. Just as much as they are. Okay. Ethics and code of ethics, key terms. You can look at these in your book, the terms for ethics, confidentiality and privacy. Ethics is really, it's kind of a gray area. So we're not talking now about laws, which is black and white. We're talking about taking the information of what you believe and making decisions for the best care of your resident or the person that you're with at the time. So there are things termed as ethical dilemmas, and if I have a moment, I'll discuss some of those at the end of this, kind of as an optional thing for you to watch, so you can kind of get some ideas of some ethical dilemmas. A code of ethics is really, again, individualized to you. It is how you view the world and the opinion you have on whether something is right or it's wrong. Again, we're not talking about legal. You can't make up what you think is right and wrong if it's written down legal or illegal. But you can certainly look at a situation and say, well, I would not do it that way, or I would view that as something that would be morally wrong. The term basic human rights, we all have basic human rights that are protected by the Constitution of the United States of America. And I like to tell people, unless you have traveled outside of the United States to a country where people do not have the same basic human rights as we do as Americans, I don't think you can truly appreciate how great our country really is. I have traveled to both South Africa as well as Haiti. I've been to Haiti 4 times, South Africa once, and South Africa was where I was very modern. I didn't really see a whole lot of mistreatment of people. Haiti was very different. I saw a lot of mistreatment, especially of the children. I saw a lot of very unfortunate treatment of adults and elderly as well. And so those trips really impacted me the most when I thought about being an American and how a lot of times we take for granted that it's a basic human right for us to be treated in a certain way. So we have the right to be treated with respect, live in dignity, pursue a meaningful life, be free from fear. And again, all of these are basic human rights. In addition to those basic human rights, our residents also have specific rights. When someone is admitted into a long-term care facility, a hospital, they are given a piece of paper, or they're given access where they can actually review their patient or their resident rights. These are legally protected rights. OBRA identifies how a resident must be treated. That's one reason why we have state-approved curriculums now for Nurse Aid 1, is so everybody is kind of on the same page about how someone should be treated and taken care of. Those rights provide a code of ethics, and again, they're posted and provided in long-term care facilities. Specifically, if you want to know what those specific resident rights are, I would again refer you to your textbook. It does speak to each individual right in your textbook. It would be a great idea. I really recommend looking in your book and looking up those resident rights. You may need to be familiar with them in the future. Okay. So, ethics. The importance of ethics is the knowledge of right and wrong guides our sense of duty and conduct. And again, ethics and law are not the same thing. The law is black and white. Ethics is kind of that gray area. And we have to make our own decisions about if we feel like something is ethically good or ethically wrong. It guides our provision of quality care, governs actions of healthcare providers, and it is vital to the safety and well-being of residents. Just for example, an age-old ethical dilemma could be, is abortion ethically right, or is it ethically wrong? I know where I stand on that issue. You may stand in a similar position. You may be totally opposite of what I believe morally and ethically. But a lot of times, it's not, again, a right or wrong answer. It is how have you been influenced in your upbringing Religion comes into this. Culture comes into this. Personal experience also comes into this. I had a friend who had an abortion when she was young. She was in her early 20s. And at the time, she really felt like that was her only option. She had had a child that had some physical disabilities and just was a single woman at the time, raising a child with disabilities, and did not feel like that she could raise another child that had any type of disability or otherwise, really. And she was pressured to have that abortion, but immediately regretted that, and did go on to have another child later on in life, but never forgot about that baby that she aborted years ago. And so her feelings on abortion changed almost instantaneously after having her abortion. So again, everybody's going to be slightly kind of feel differently about that, and that's okay. Ethical dilemmas are good for us to sit down and talk about and debate. Every time I sit down with students and debate in class those ethical dilemmas, I always learn something. I always get an insight into something maybe I hadn't thought about. But we'll do some of that kind of after this video. All right, so the nurse aide's role is to use good judgment, keep information confidential, document accurately, that's very important, follow the plan of care, be honest and trustworthy. I would love to say that everybody in healthcare is honest and trustworthy, but more and more we have people that, for whatever reason, are entering into all kinds of jobs, but healthcare also, and they are very dishonest, and they're doing things that are very very negative in their personal lives as well as in their professional lives. So I encourage you to be as honest and trustworthy as you can be, because you want the same thing for you or your family if they were the patient. Okay, report any abuse or suspected abuse. Understand and respect the residents' rights. And to understand them and respect them, you need to make sure that you know what they are. So again, look those up in your book. The nurse aide should report observations and any incidences. Show empathy. And I should have already explained to you the difference between empathy, sympathy, and apathy. Empathy is the better choice of the three. Empathy is really trying to put yourself in that other person's kind of place or position and feel the feelings that they're going through. Sympathy, it's your next best bet, but sympathy is really feeling sorry for another person, and usually that's not as beneficial as empathy. And then apathy means no emotion. It means I don't care. I'm not touched by your problem. I'm not affected. Okay, and we never want to be apathetic to our residents or their families. Respect residents equally, provide quality resident care, protect their privacy, treat everyone professionally, avoid stereotyping. That's one of my favorite things to talk about. It is normal human thought and behavior to automatically make assumptions about people based on how they look, how they talk, what they're wearing, how they smell, a variety of things, okay? But you can't look at somebody by the color of their skin, whether they're male or female, their age, and determine how intelligent they are, what their likes and dislikes are. So I always like to try to put out of mind any of stereotypes that I have and really get to know my students, especially before I have some concerns about whether I feel like they're going to be successful or not. And I've had students that first impression really, really was different than kind of how I ended up seeing them at the end of the class. And you should try to do the same, but it's normal. It's normal to stereotype people, but remember to tell yourself, nope, I'm not going to make an assumption. I'm going to get to know this person, or I'm going to learn more about them before I, feel like this is not, we're not going to be able to be friends or jive or whatever. Safeguard property, respect values and beliefs. And keep in mind, those values and beliefs could be very different than your own. There's nothing wrong with that. Okay. So I've learned, again, a lot of things from people that we had differing opinions on things, and that's just life. That's the way it is. So some points to remember. What is ethical behavior? You want to keep in mind that ethical behavior is putting the needs and the best care practices for another person at the forefront. That should be the most important thing, is we're thinking ethically about our care for our patients. When do nurse aides use ethical behavior? I'll give you 2 guesses, and the first one doesn't count. Always. Personal life, professional life, you should always be using ethical behavior, because people see you out in public, on social media. That carries over to your professional life. So just be careful with that. Ethical behavior can vary. Remember, we said that's a gray area a lot of times. And remember, we're all individuals who think differently. And that's a good thing. It's a good thing that we all have different perspectives and we look at things different ways, because we can teach each other so much from discussing things from different perspectives. End of life care is probably a lot of ethics are used in that area. End of life decision making usually follows the resident's individual ethical principles. One thing we cannot do is we cannot project our own ethical feelings and beliefs on another person when they're making these decisions. Nurse aides need to respect the fact that the resident has the right to make their own end-of-life decisions, which may differ from the ethics of the nurse aide. So I've got 2 examples here. The resident, number 1, has the right to refuse treatment. Now, I'm all about refusal of treatment, but as a nurse, I have run into some times when I didn't agree with the patient refusing treatment. One of those times was early in my nursing career. I was working on an oncology unit, and I had a young mother in her 20s that had 2 small children, young husband, and she had ovarian cancer, very late stages, and she refused surgery. She refused chemotherapy, radiation, all treatments. She did not want anything. I felt that it was very cruel to put her family through that. You would have to really be in the situation to understand. It wasn't just that she was dying. It was that she was, the cancer was very malodorous. It was extremely bad smelling. Her children could not visit her. Her husband could visit her for only just a few moments at a time. We had industrial strength deodorizers going in her room, and it barely touched the odor that was coming from her body. And it was because that cancer was still growing inside of her body, and there was a lot of very foul secretions coming out. But it was her choice. And we as nurses, we had a really hard time taking care of her for a lot of different reasons. It was emotional, but it was also physically difficult because of the odor and the care we had to provide for her. But we had to remind ourselves that we may have done something differently, but it was her choice to not seek treatment. And then the right to request everything. Again, I'm all for it. Let's do whatever the patient needs us to do. But there does come a point where we as healthcare workers sometimes do not agree with doing CPR on that 98-year-old person. We do not agree with the family telling us that they need to leave this person on a ventilator, and it's been an extremely long journey, and we feel like the patient is suffering because of the prolonged treatment. Yes, it is their right. Do I agree with it? I agree with it to a point. And then, yes, as a nurse, I have taken time to pull the family aside and say, do you have any questions about what's going on? And I understand your desire to keep this person alive and here on earth with you. And we'll do everything we can to help you with that. But let's talk about the alternative to that. And let's decide, is there going to be a time in the future where we may not want to do things the same way we're doing them now? And I've had doctors that did not appreciate that. But it is in my scope of practice as a nurse to introduce those thoughts to a family member that's struggling with those kind of decisions. Law and ethics is very interesting to me as a nurse. I have had a certification as a legal nurse consultant, and I've done a little bit of work in that area, not a lot, but I am very interested in the law and ethical conduct. I will go ahead and finish up this video now, and there'll be another video link that will just discuss some ethical issues if you would like to have a little bit more information on that.